Do your eyes feel irritated or like something is in them? Are you experiencing redness, burning, excessive tearing, or occasional blurry vision? You may have dry eye, a common condition where your eyes do not produce enough tears. Sometimes, the only symptom of dry eye is recurring blurred vision. Because there are many possible causes of dry eye, we gather a patient health history to better understand your risk. For example, common medications such as diuretics or antihistamines increase dry eye risk. You are also more likely to have dry eye if you wear contact lenses, recently had LASIK eye surgery, or use 2 or more glaucoma eye drops. Quite often, thyroid dysfunction and the hormonal changes associated with menopause can cause dry eye. In addition, your work environment can also affect your eye health. For example, people who use a computer all day long are more susceptible to dry eye. If we determine that you are at risk for dry eye based on your symptoms and risk factors, we can perform state-of-the-art tests to evaluate and understand the underlying reasons for your dry eye. We will work with you to identify the best treatment plan for your unique needs. Think you might have dry eye? Talk with us today about how we can help you find relief. If you think you might have dry eye, your eye care professional will ask you a few questions and perform some tests in order to confirm the diagnosis and understand the cause of your dry eye. This helps your doctor design the best treatment plan. There are a variety of reasons you may be experiencing dry eye. Because tears help lubricate and protect the eye, dry eye is often caused by not producing enough tears or not producing the right quality tears. To see how many tears your eye produces, your eye care professional may use a paper or thread test that can measure the volume of your tears. They also might use stains to see where dry spots have formed, causing damage to the eye's surface. To measure the health of your tears, your eye care professional may take a sample of your tears to test the salt content and concentration of your tears. Oil is another key component of healthy tears. Glands in your eyelids play a big role in producing oil for your tears. So your doctor will examine your eyelids for blockages or eyelid inflammation. Talk to us today about the best tests to determine if you have dry eye. There are many treatments to relieve the symptoms of dry eye, which range from making simple changes in your home to in-office procedures. It depends on the underlying cause of your dry eye. No matter what your individual treatment plan entails, the most important thing to remember is to be consistent and follow instructions regularly. Dry eye can be managed so that you can be symptom-free for months, even years. But even if you no longer have symptoms, you must still continue the treatment program prescribed by your eye care professional to keep dry eye at bay. Because dry eye is an inflammatory condition like arthritis, you can experience flare-ups from time to time. Should this happen, just schedule an appointment with us. We'll always work with you to find the best plan to keep your eyes moisturized, comfortable, and healthy. There are a variety of dry eye treatments available to provide relief from dry eye. Once your eye care professional identifies the underlying cause of your dry eye, He or she will work with you to design a flexible treatment plan customized to your needs. If your dry eye is caused by your environment or behavior, you may be advised to make small changes. These can be as simple as reducing the speed of ceiling fans in your home, or remembering to blink more often when you use computers. Your eye care professional may recommend drinking more water, or eating foods or supplements high in omega fatty acids or vitamin A. Your tear production might also be the cause of your dry eye. Eye drops, including prescription medications, artificial tear drops, gels, or ointments, are often used to increase eye moisture or tear production and may be used in combination with other treatments. Another option, called punctal plugs, retains tears in the eye by blocking the tear drainage canal. If you are experiencing dry eye as a result of another condition, your eye care professional will also treat that cause. For example, if you wear contact lenses, you may need to try other types of lenses. If you have inflamed or clogged eyelid glands, your doctor will offer methods to treat the glands, ranging from at-home lid hygiene techniques to in-office procedures. Let us work with you to find the best course of treatment for your dry eye.
O olho seco vem sendo tradicionalmente tratado com lágrimas artificiais adquiríveis sem prescrição médica. Lágrimas artificiais são utilizadas para ajudar a fornecer fluidos, minerais e materiais lubrificantes adicionais que são encontrados nas lágrimas normais. Quando utilizadas adequadamente, as lágrimas artificiais são um tratamento seguro, acessível e eficaz contra olho seco. Elas são destinadas a suavizar a irritação, aliviar temporariamente os sintomas de olho seco e ajudar a proteger o olho contra maiores irritações. As lágrimas artificiais também podem ser utilizadas como adjuvantes em outros tratamentos de olho seco. Os ingredientes e as características variam e diferentes fórmulas podem ser ideais para cada indivíduo. Seu médico poderá recomendar uma fórmula que seja ideal para o seu caso. Um tipo de tratamento para olho seco é preservar as lágrimas que a pessoa já tem. Isto pode ser feito através do bloqueio dos canais de drenagem lacrimal, utilizando um plug lacrimal. Os plugs lacrimais, que podem ser temporários ou permanentes, são inseridos de forma indolor nos canais lacrimais em um consultório oftalmológico, e geralmente a pessoa não sente os plugs quando inseridos no olho. O bloqueio dos canais lacrimais evita que as lágrimas sejam escoadas do olho muito rapidamente. Quando utilizados juntamente com outros tratamentos para olho seco, o olho permanece umedecido e protegido pelas lágrimas durante um tempo maior. Ao reter as lágrimas, os plugs lacrimais ajudam a reduzir o ressecamento e podem reduzir os sintomas de olho seco. Um teste simples de olho seco é chamado de teste de fio de vermelho de fenol. O teste de fio de vermelho de fenol é utilizado para medir a quantidade de lágrimas produzidas pelos olhos de um paciente. Para este teste, um fio de algodão é tingido com o corante vermelho de fenol, o qual muda de cor quando molhado pelas lágrimas. O fio é colocado na pálpebra inferior por 15 segundos, o qual é molhado pelas lágrimas do paciente. A quantidade de variação da cor do fio, que demonstra a proporção de fio que foi molhada pelas lágrimas, é a medida em milímetros. Se a porção molhada pelas lágrimas é menor do que uma determinada quantidade, isto pode indicar a presença de olho seco.
One treatment for a certain type of chronic dry eye is a prescription medicine called Restasis. cyclosporine ophthalmic emulsion 0.05%. Restasis helps increase your eye's natural ability to produce tears, which may be reduced by inflammation due to chronic dry eye. Restasis ophthalmic emulsion did not increase tear production in patients using topical steroid drops or tear duct plugs. Restasis comes in the form of eye drops. One drop is applied to each eye twice a day to stimulate the production of tears. After using Restasis ophthalmic emulsion regularly for a few months, many patients begin producing more of their own tears. As the production of tears increases, patients may begin to experience less of a need for artificial tears. Some patients may experience side effects from Restasis or may not be good candidates for the treatment. Your eye doctor may be able to determine if you have the type of chronic dry eye that would make Restasis ophthalmic emulsion a good treatment for you. Restasis helps increase tear production in cases where it may be reduced by inflammation due to chronic dry eye. Restasis ophthalmic emulsion did not increase tear production in patients using topical steroid drops or tear duct plugs. Restasis should not be used by patients with active eye infections and has not been studied in patients with a history of herpes viral infections of the eye. The most common side effect is a temporary burning sensation. Other side effects include eye redness, discharge, watery eyes, eye pain, foreign body sensation, itching, stinging, and blurred vision. Prescribing information for Restasis ophthalmic emulsion has been provided to your doctor. Talk to your doctor to find out if a prescription for Restasis is right for you. When the eyes are dry, tears do not adequately protect the eye's surface. Dry spots form. And over time, damage to the eye's surface may occur. Special dyes, including lysamine green, rose bengal, and fluorescein, can be used to determine the extent of damage to the surface of the eye. When applied to the eye, these dyes adhere to damaged spots on the conjunctiva and cornea, allowing the doctor to determine the severity of surface damage as part of his or her diagnosis of the patient's dry eye condition. One simple test for dry eye is called the Schirmer test. The Schirmer test is used to measure the amount of tears made by a patient's eyes. For this test, a thin strip of filter paper is placed over the lower eyelid at the edge of the eye after numbing drops are given. After a few minutes, the paper absorbs tears from the eye, and the amount of wetting is measured in millimeters. If the amount of wetting measured is less than a certain amount, it may indicate the presence of dry eye. One test for dry eye is known as the tear breakup time test. The tear breakup time test can provide an important measurement of how well a patient's tears wet and protect the eye's surface. For this test, a small amount of fluorescein dye will be applied to the eye so that it mixes with the tear film. The patient is asked to blink, and then asked to keep their eye open for the doctor to see. After each blink, the tear film will thin and evaporate, forming dry spots due to insufficient wetting of areas on the eye surface. While the patient holds their eye open, The doctor measures how long it takes for the first dry or dark spot in the tear film to appear, indicating the tear film has broken up. If tear breakup occurs in a very short time, it may be an indication of dry eye.
In order to determine if you have dry eye, your doctor may perform one or more tests to assess your condition. One simple test for dry eye disease is called a tear osmolarity test. This test measures the salt content of your tears, which is a major indicator of dry eye disease. The tear osmolarity test has been shown to have the best predictive value for diagnosing dry eye disease of any single test. During the test, a tiny tear sample is measured from both eyes, and the osmolarity number is generated for each eye. Based on your readings, your doctor can determine whether you have dry eye disease, and if so, whether you fall in the mild, moderate, or severe category. This will aid your doctor in the development of the appropriate treatment regimen to bring the ocular surface and tear film back to good health. Ask your doctor about the tear osmolarity test today.
It is important to remember that dry eye is not just a minor discomfort. Dry eye is a serious progressive condition that can potentially lead to serious vision problems. The key to improving this condition and avoiding damage to the eyes is to recognize the symptoms of dry eye and to seek treatment for it. Many people never mention their dry eye symptoms to their doctor. There are several effective treatments available for dry eye patients. Doctors can help patients relieve or improve their dry eye symptoms. Ask your eye care professional about your options.
Sjogren syndrome is an autoimmune disorder. Your immune system mistakes the moisture-secreting glands in your eyes and mouth as harmful to your body. In order to neutralize the threat, your white blood cells begin attacking these glands. The result is a decrease in the production of tears and saliva. Due to this decline in moisture production, your eyes may burn, itch, or feel gritty, and your mouth may feel dry, making it difficult to swallow or speak. Other parts of your body, besides your eyes and mouth, may become targets as well, including your joints, thyroid, kidneys, genitals, liver, lungs, skin, and nerves. Attacks in these areas can lead to symptoms such as joint pain and swelling, rashes or dry skin, persistent dry cough, and prolonged fatigue. If you are suffering from some or all of these symptoms, please reach out to your doctor to discuss your concerns. In most cases, the individual symptoms of Sjogren syndrome can be managed with over-the-counter or prescription medication. But in some cases, a minor surgical procedure may be performed to alleviate your symptoms. If you have never used eye drops before, it may take just a bit of practice to get them into your eye, because the natural reflex is to blink to avoid the drops. The eye drop will be effective if it lands on either the eyeball or in the pinkish inside surface of the lower lid. However, if the eye drop lands on the eyelid skin or on the lashes, you will have to try again. Whenever possible, try to wash your hands before using eye drop medications. Eye drop installation is easiest if you either lie down or tilt your head back. If you are right-handed, use the thumb and first 2 fingers of your right hand to hold the inverted eye drop bottle. Hold the eyelids open by using your left index finger for the upper lid and your right pinky finger for the lower lid. Hold the inverted bottle directly over your eye. Look at or slightly to the side of the bottle. Press the bottle lightly with your fingertips to cause one drop to come out. Without excessive squeezing, close the eye gently for a minute after instilling a drop. It is normal that some drops will sting. If more than one type of eye drop is prescribed, they can be used in any order, but should be taken at least 3 minutes apart so that the eye has time to absorb each one completely. You need only one eye drop of medication for one dose. Don't worry if you accidentally apply several drops. It won't harm the eye. If you think you missed your eye, it's okay to apply another drop. While you're first learning to use eye drops, you may want to refrigerate your eye drops. This makes it easier to tell whether the drop lands on the eyeball. Some people rely on a spouse or other family member to help them with the eye drops. Even if you have the option, it's better if you learn to do it yourself in case your helper isn't available.
Existem diversos problemas oculares que podem causar desconforto. Seu oftalmologista pode indicar uma limpeza palpebral com água morna, usando uma compressa para aliviar os sintomas associados a um quadro particular. Comece lavando as mãos com água e sabão. Depois, umedeça um pano limpo com água morna. Com os olhos fechados, passe o pano umedecido e morno sobre as pálpebras por cerca de 5 minutos. Repetir o processo usando um novo pano, tantas vezes ao dia quantas forem recomendadas por seu oftalmologista, ou tanto quanto for necessário para aliviar os sintomas. A compreensão da estrutura da lágrima é importante, pois o filme lacrimal oferece ao olho algumas funções especializadas. Nossa lágrima é produzida por glândulas minúsculas que ficam ao redor dos olhos, dispostas internamente nas pálpebras. A lágrima ou filme lacrimal é composta de 3 camadas: lipídica, aquosa e mucosa. A camada mais interna, próxima da córnea, é a mucosa, que serve como uma âncora firmando o filme lacrimal à córnea. A camada média, aquosa, é composta basicamente de água. A camada externa, lipídica, evita a evaporação, selando o filme. A lágrima tem diversas funções. Ela mantém o olho lubrificado, cria uma fina superfície lisa pela qual passa a luz que atravessa o olho, nutre a parte anterior do olho e protege o olho de trauma e infecção. Quando piscamos, as pálpebras afinam e espalham o filme lacrimal para que forme uma fina camada uniforme na superfície anterior da córnea. O excesso de lágrimas pode sair do olho em dutos estreitos, que drenam para o meato nasal.
In the United States alone, 19 million people suffer with dry eye, and approximately 2.7 million people suffer from severe dry eye. Dry eye is one of the most common reasons patients visit their eye doctor. It causes discomfort and unsightly redness on the surface of the eye, and can cause visual symptoms such as blurred vision and sensitivity to light. Our tears are a complex mixture of water, oils, and mucus. When vision is healthy, a balance exists between the tear layers. If an imbalance occurs with one or more of the tear layers, the tear system breaks down and dry spots develop. This is called dry eye and occurs due to insufficient production of tears or excessive evaporation of the tear film. Dry eye can occur for a number of different reasons, including age, gender, medications, and environmental factors. Over-the-counter eye drops may be a useful treatment option for mild cases of dry eye. However, as dry eye becomes more severe, prescription treatments, along with over-the-counter eye drops, are needed to help relieve your symptoms. Without treatment, common tasks such as reading, watching television, or driving may become difficult or tiring. Severe dry eye can also lead to eye infections and corneal scarring. A new treatment option for severe dry eye is Procara, a corneal healing lens slightly larger than a standard contact lens. Procara is a natural option that has powerful healing effects which help return the surface of your eye back to a normal, healthy state. Clinical studies have shown that Procara helps soothe pain, heal the eye, and improve vision. Procara is inserted and removed in your doctor's office in a manner similar to contacts. Once removed, Procara renews the surface of your eye, so you can see the world more clearly while looking and feeling your best. In a clinical survey, 93% of patients who have used Procara for dry eye said they felt better after treatment. Are you experiencing any of these symptoms? Redness, stinging or pain, blurred vision, or sensitivity to light? If you are, talk to your doctor today about whether Procara could be the right treatment option for you.
The burning question for millions. Is it dry eye or MGD? Have you ever been told you have dry eye with symptoms like tired, red, burning, scratchy, or watery eyes? Here's a fact. Roughly 90% of all those who have been diagnosed with dry eye have a condition called meibomian gland dysfunction. Most refer to it as MGD, and it's treatable. What is MGD? Let's take a look. Your eyes produce tears from glands called lacrimal glands. This is the watery layer on our eyes. Your eyes also produce essential oils from the meibomian glands located in the eyelids. The oil protects the watery layer in our eyes. If there is a lack of oil, the watery layer evaporates and our eyes are left unprotected. Simply put, your tear production may be healthy, but blocked meibomian glands lead to a lack of oil production, causing the tears to evaporate. If left untreated, these blocked glands can begin to shrink and can eventually deteriorate, making the damage irreparable. This is why addressing MGD sooner rather than later is your best option. Good news! Through groundbreaking innovations in eye care, MGD can be treated with LipiFlow. LipiFlow is a proven, in-office FDA-cleared treatment that unblocks the meibomian glands and restores natural oil production in your eyes. During treatment, you'll feel therapeutic heat and gentle massaging with little to no discomfort. Now millions diagnosed with dry eye can get back to enjoying everyday activities. Finally, an answer. A real solution and real relief. Ask your eye care professional, is it dry eye or MGD? Ask if you're a candidate for LipiFlow. Ask us about LipiFlow and MGD today.
The LipiFlow system uses heat and a 12-minute pressure profile to remove blockages in the meibomian glands. By heating the glands from the inside, blockages are liquefied. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland. The LipiFlow activator insulates on its inner surface and vaults the cornea to protect it from heat. Therapeutic heat of 42.5 degrees is accurately controlled and directed outward, away from the cornea to the lids. The device never lets the cornea exceed a safe 39.5 degrees, unlike chemical heat packs that have been shown to overheat. Also, unlike manual lid massage. LipiFlow safely applies pressure to the lids, not to the cornea or the globe.
Heat is applied in very close proximity to the glands for the entire 12 minutes. It will not get too hot, and the eyeball itself only increases by 0.2 degrees Fahrenheit. So the eye itself is not getting that heat, the back of the lid is. Activators in close proximity to the gland, and at various stages of the procedure there will be various amounts of pressure and pulsation. It doesn't get too hot, and the pulsation doesn't get uncomfortable.
It feels great. I mean, my eyes feel the lids are moving smoothly, whereas before they felt kind of like not totally sandpaper, but pretty tough to open and close. So it feels better.
Clearadex is a safe and effective way to eradicate Demodex mites. Infestations of Demodex mites frequently occur in the eyelash follicles, leading to several common ocular conditions, and soap and water is not enough to wash them away. Clearadex is derived from the key component in tea tree oil called 4-terpineol. It provides all the Demodex fighting benefits of tea tree oil without any of the potentially irritating side effects. This patented, all-natural, preservative-free formulation is applied once or twice daily. Clearadex effectively cleans and soothes the skin around the eyes, nose, and face. And the 4-terpineol in Clearadex eradicates the mites and bacteria which lead to symptoms associated with blepharitis, dry, itchy eyes, styes, and rosacea. Unlike other tea tree oil products, Clearadex is non-irritating and safe for everyday use. Depending on the severity of your symptoms, your doctor may also recommend an in-office solution called Clearadex Complete to supplement your at-home Clearadex treatments. Clearadex is a safe and effective way to eradicate Demodex mites, not just the symptoms they cause. To learn more about Clearadex, speak with your doctor or visit Clearadex.com.